Sacroiliac Joint by Nikki Thomas, Caitlin Bath, J.P. Swanson, and Kayla Van Handel. The sacroiliac joint is a joint connection between the spine and the pelvis. It is a space located between the sacrum bone and the back of the pelvis. There are actually two sacroiliac joints in our body, one on the right side and one on the left. There are many ligaments that support this joint. However, we will get into the ligaments further in this presentation. There are two different types of cartilage covering the joint. There's hyaline cartilage, which is on the sacral surface, and fibrocartilage, which is on the iliac surface. As we age, the characteristics of the sacroiliac joint change. The joint surfaces are flat or planar in early life, but as we start walking, the sacroiliac joint surfaces develop distinct angular orientation and lose their planar or flat structure. The front of the sacroiliac joint is classified as a diarthroidal joint, and the back of this joint is not as movable as the front and is a synovial plane joint. There is overall little motion at the sacroiliac joint. Its function is to absorb shock between the upper body, pelvis, and legs, and help with small movements that can help forward and backward bending. Alright, so on my front here, the skeleton, the sacroiliac joint is the connection between the spine and the pelvis, so it'll be found right here on either side. So there are two of them, and as you can see from the back, the connection would be right here. Again, its function doesn't have much movement, but its main function is to absorb shock.
The first ligament we'll be looking at is the anterior sacroiliac ligament. This ligament is located on the anterior portion of the fibrous capsule of the synovial part of the sacroiliac joint. Although the ligaments at this joint are considered the strongest in the body, the anterior sacroiliac ligament is weak and thin compared to the other ligaments of the joint. This ligament connects the third sacral ligament to lateral side of the preauricular sulcus. The ligament is better developed closer to the arcuate line and the posterior superior iliac spine. This ligament is most often injured of the group and is common source of pain due to its thinness. The next ligament is the posterior sacroiliac ligaments, which are located on the posterior side of the sacroiliac joint. These ligaments help form the sacrotuberous ligament. This ligament connects the posterior superior iliac spine with the lateral crest of the third and fourth segments of the sacrum, and is strong and tough. There are two parts of this ligament, which include the upper part, which the ligament runs horizontal to the spine, and then the lower part, which the ligament runs diagonal to the spine. And then lastly, around this joint, we can see hypermobility due to loose ligaments and can be a result of pregnancy or injury to the sacroiliac joint, which can cause leg or back pain.
The interosseous sacroiliac ligament. The interosseous sacroiliac ligament is the deepest SI ligament that connects the sacrum and the ilium. It can be found within the narrow cleft above and behind the auricular surface, as seen in the picture. The interosseous sacroiliac ligament is short and thick and is the strongest ligament in the body. The interosseous sacroiliac ligament prevents anterior and inferior movement of the sacrum. Injury can occur from increased mobility, commonly found in high-impact injuries, such as a motor vehicle accident, fall, or repetitive trauma from heavy weightlifting or sports-related injuries. The iliolumbar ligament. The iliolumbar ligament is one of the three vertebropelvic ligaments. It is also made up of two bands. The first is the anterior band, which originates at the aspect of the infralateral portion of the L5 transverse process. The second anterior band originates anteriorly, laterally, and posteriorly from the infralateral aspect of the L5 transverse process, which then both inserts on the anterior portion of the iliac tuberosity. The posterior band originates from the apex of the L5 transverse process and its fusiform, which then inserts on the anterior margin and apex of the iliac crest. The iliolumbar ligament stabilizes the lumbosacral spine of the pelvis, specifically within the lower lumbar region. Injury is common among athletes from repetitive motion of the lower spine. even though injury to this ligament is rare. When injured, most find that bending to one side becomes painful in the sacroiliac joint area.
Another important ligament of the sacroiliac joint is the sacrotuberous ligament. It is a flat, triangular ligament on the posterior pelvis. Its fibers originate from 4 locations. The first location is the 4th and 5th transverse tubercles of the sacrum. The second location is the posterior inferior spine of the ilium. The third location are the lower lateral margins of the posterior sacrum, and the fourth location is the superior aspect of the coccyx. From these originations, the sacrotuberous ligament passes down, forward, and lateral from its base. Its fibers run in an oblique direction. The ligament narrows in the middle before fanning out again and inserting onto the medial surface of the ischial tuberosity. It's important to note that the long head of the biceps femoris is continuous with the lower border of the sacrotuberous ligament. The gluteus maximus muscle also attaches to this ligament. This ligament has important functions within the sacroiliac joint. First, it limits upward tilting of the sacrum. This motion is called nutation. It involves the base of the sacrum moving anteriorly in the sagittal plane about the mediolateral axis. The sacrotuberous ligament also limits rotation of the pelvis. The sacrospinous ligament is a thin triangular ligament on the posterior pelvis. Its base arises from the lateral margins of the sacrum and the coccyx. From its base, the sacrospinous ligament runs anteriorly to the coccygeus muscle. It intermingles with the sacrotuberous ligament fibers that enter posteriorly. The two ligaments share space and then insert onto the spine of the ischium. The sacrospinous ligament serves as a border for the greater sciatic notch and the lesser sciatic notch. The greater sciatic notch is formed above the ligament, and the lesser sciatic notch is formed below the ligament. The sacrospinous ligament then serves as the border for the greater and lesser sciatic foramina. The sacrospinous ligament has the same function as the sacrotuberous ligament. It limits the upward tilting of the sacrum. Again, this motion is called nutation. It involves the base of the sacrum moving anteriorly in the sagittal plane, about the mediolateral axis. It also serves to stabilize the pelvic girdle and limit rotation of the pelvis. Let's talk about nutation. Nutation is a movement that happens between the sacrum and the pelvic girdle. When you do a back bend, the top of your sacrum slides backwards and the bottom part moves forward, like this. This is called counter nutation. When you do a forward fold, the top of your sacrum slides forward while the bottom part of your sacrum moves backwards posteriorly. This is called nutation. Both of these movements happen in the sagittal plane. That's counter nutation and nutation.